Hey everyone! Welcome back to Physiotechs. Today, we're diving into a crucial topic for athletes and active individuals: rehabilitation for sports injuries. Whether you've just experienced an injury or want to learn how to prevent them, I'll cover common injuries, effective assessment and treatment techniques, and essential prevention strategies. But before we jump into our topic, if you are new to Physiotechs, please do not forget to like, share, subscribe, and hit the bell icon for the latest updates from Physiotechs. Sports injuries are common in athletes due to the repetitive physical demands of training, competition, and sometimes poor technique. Effective rehabilitation involves proper assessment, treatment through physiotherapy, and injury prevention. So let's break down some common sports injuries. Sprains are injuries to ligaments, commonly in ankles, knees, and wrists. Strains are injuries to muscles or tendons, often affecting the hamstrings, groin, and lower back. This is the inflammation of tendons due to overuse, typically affecting the shoulder, elbow, like tennis elbow, or knee. Fractures are broken bones, often occurring in high-impact sports like football, skiing, or basketball. Joints such as the shoulder are forced out of position, usually from sudden trauma. Pain along the shin bone due to overuse, common in runners and dancers. A tear or strain in the ACL, common in sports that involve sudden stops and changes in direction, like soccer and basketball. Damage to the knee's meniscus, often from twisting movements. These involve a group of muscles and tendons around the shoulder joint that can get strained or torn due to repetitive overhead activities. A brain injury caused by impact, common in contact sports like rugby and boxing. Now let's talk about assessing these injuries. Understanding the details of the injury, symptoms, and relevant medical history. This includes observation for swelling, bruising, and deformity, palpation for tenderness and warmth, range of motion, ROM, assessments, strength testing, and special tests like the Lockman's test for ACL injuries. X-rays help assess fractures, while MRI and CT scans evaluate soft tissue injuries. Moving on to treatment through physiotherapy. In the first few days, follow the RICE protocol: rest, ice, compression, elevation, to reduce pain and inflammation. Pain management can include heat therapy or NSAIDs, and electrotherapy like ultrasound or TENS for pain relief. Engage in range of motion exercises, strengthening exercises, proprioception, balance training, and manual therapy like massage and joint mobilization. This includes plyometric training, agility drills, and sport-specific movements to ensure a safe return to play. Taping and bracing can also support joints and prevent further injury during recovery. Lastly, let's talk about injury prevention. Engage in dynamic stretching and gradual movements before sports. Cool down with stretching exercises. Build overall muscle strength and endurance. Educate on correct techniques to reduce strain on the body. Exercises to improve body control and balance. Allow time for muscles to recover before